Good morning, everybody. We're here with Barb this morning. How you doing, Barb?
Good. How are you?
Very good. Just a little forgetful.
It's early.
Okay.
I'm a little tired.
Okay, so this morning we're going to be doing some sculpting on the ankles and the knee area.
Yes.
Yeah, so we call those cankles too. Okay.
Yeah.
So Barb, you want to tell everybody, what your reason for coming down here?
Well, I've had these ankles forever, since I hit puberty, I guess. I found you on the internet, browsing one day, talked to a couple surgeons. They said I didn't have enough fat down there. So I was excited. I saw your videos and I was like, oh my goodness, I think I called the next week and talked to Nicole and now we're here.
Okay. So you talked to a surgeon, are you talking about cosmetic or plastic surgeons?
Plastic surgeon, yes.
Okay. And their thought was that you didn't have enough to be able to remove it and make a difference.
Yes.
Okay. Did that make sense to you?
No. And he's like, well, maybe you shouldn't work out down there, your ankles. And I was like, I was a little disappointed, but I had looked into it before, so. Yeah. And no results.
Okay. So it's the same kind of thing that other people did not want to do it.
That's right. Yes.
And for our audience out there, that's kind of what I hear all the time. We have people come from all over the world. And do you mind telling everybody where you're from?
No, I'm from Ontario, Canada.
Okay. So
yes.
So we have a lot of Canadians. We have UK. We have people from all over the world, actually. And so there's no place really that doctors are really trained to do a lot of this. In the United States, I know maybe 1 or 2% of the doctors that do liposuction may get into the ankles. I mean, it's a really small percentage, and of those, they hardly do anything. So we love doing it though, because it's really it's not that difficult if you get some experience in doing it. We've done hundreds of them here, so we're going to see the results immediately too today. So as we finish one, we'll probably film a little bit. Definitely after the second one, we'll film some more here. So you'll get to see immediately what the change is. So I'm going to take the camera now, and then as you stand there, Barb, I'm just going to take a look right here. And can you just shift and turn your legs from one side to the other?
Yes.
Okay, and go back to the other side. Okay, and then can you turn all the way around? All the way around, facing the wall. Okay. And I'm just going to pull back here. Okay, and then turn just a little bit side to side. Okay, and then back. Okay, so what we're going to do, and can you pan down, Angie, is we're going to treat this whole area. This is what we call the cankle, from the calf down. However, what I have marked here is all the way up to here, and this is what I call the the knee complex. Okay, because most of the women that come and see us, although they're concentrating on this, the area above the ankles is really important. Let me shift you just a little bit. So as you can see here, we have an inner bulging of the knee, which is very common in women, and there's some fat out here too. So when we take out both the inner and outer, this is going to make a huge difference. And it's an area that, again, other doctors, they treat the knee, and you'll hear other doctors talk about how they treat the knee, but usually it's just this. It's not both sides, and it's not blending up into the middle part of the thigh. It's not creating a drastic or dramatic change in the contour like we're going to do today. Okay, so this is something that we do in many cases in conjunction with the ankles. Okay, and it's a separate area, but it's a very important area. Hey Barb.
Hey, how's it going?
Good. We're back live again. So how was it so far?
Pretty good actually.
Okay. So we just finished the first side, which you haven't seen yet. So you can sit up here.
Oh my gosh. Oh wow. I'm like shocked. Sorry. Because when you showed me before. Okay. That's amazing.
Okay. Bring closer together right there. Wow. So this leg is the one we just finished. This leg is a little bit puffed up with some fluid in it right now, but gives you still a pretty good idea.
Wow.
And let's take it. Yeah. So you want to go and step up? Okay. Let's step you down on this pad. We'll go in front of the mirror. Okay. You can take that towel off it.
Yeah.
Okay.
Wow. I'm a little tense, I think.
Yeah.
And shoulders, keep breathing.
So how's it look?
Good. Oh my gosh, I
Okay,
can't.
go and turn a little bit side to side so you can see it from different angles, okay? Because we worked all the way around.
Wow. That's crazy. I can't believe it. A calf, actually, and an ankle. That's crazy. Doesn't look like my leg.
Doesn't look like your leg, right? we hear that all the time. Doesn't look like my leg. Good. We don't want it to look exactly like your leg. So once you turn this way and face me so I can get it just a good straight on. Legs a tiny bit apart. Okay. So one done. One to go.
Your shoulders.
Okay.
Wow.
Are you happy?
Yeah.
Okay, great. Okay, hey everybody, we're back with Barb. Okay,
Hey.
so you want to tell everybody what you're saying?
Well, I just feel so emotional. Like, I love it. I love my knees, and I have ankles, and like, thank you so much.
You're
So glad I
welcome.
found you.
Okay,
This was nothing.
great. So you see, okay, so when we swing on over here, you get to see it from sitting down, but let's go up in front of the mirror and let's go take a look, okay? Okay.
Oh, that's amazing. I love it.
I'm gonna do a little bit from the back side here. You want to go up on your tippy toes here for us? Awesome.
My
Okay.
calves feel
Okay.
so good.
All right. You can turn and like take a look from different directions.
So amazing. So cool.
They look pretty athletic now, right?
God, yeah. Wow. Very. It looks amazing. I love it.
Okay. Awesome. So let me have you step back there so I can use the wall as the background to step a little bit further back. You can step off the
Yeah,
the
thank
pad
you.
right there, but not on the wall. Okay. You can come out just a little tiny bit.
Yeah.
Great. That's perfect. Okay. So I'm just going to take a look from this side. Bring your legs a little closer together. Okay.
Relax your shoulders.
Okay. You want to turn around for everybody?
Yes.
Turn all the way around, facing the wall.
Wow.
Okay. That's it. Okay, so you turn around and any last comments?
Thank you so much. This was well worth it.
Okay.
Definitely.
Okay.
Thank you.
all.
Thank you so much.
Thank you, Barb. Okay.